Hey, Andy Neary here. Before we dive into today's podcast episode, think back to how you came upon this podcast. Maybe it was through a post, a share, or one of your own peers shared this podcast with you. I don't take any ads. I don't take any sponsorships. The only way this podcast grows is through word of mouth. So if you would be so kind to share this with a peer, with a teammate, with a friend, a family member, I would be forever grateful to you. This is how we impact more business professionals, and this is how this podcast grows. All right, let's dive into today's episode. Hey, welcome back to Bullpen Sessions. I am really excited today. I'm reconnecting with a gentleman who was a part of my past in the industry, and I've had a chance to reconnect with him now that Amy and I have moved back to Wisconsin. And this is going to be an exciting episode because Chris, who I'm about to introduce to you, has put together a really cool presentation about the history of health insurance. And I wanted to have Chris on because I think for the benefit advisors out there who are selling today, I'd be willing to argue most of them don't have a clear picture of why this industry has gotten to where it is today and how health insurance in this country has operated for the last 60 to 70 years. So with that being said, Chris Ekus, welcome to Bullpen Sessions.
Hey, thanks, Andy. Glad to be here.
Well, Chris, we're going to talk about the history of health insurance. And when you and I grabbed coffee, I coined you the health insurance historian. So we're going to talk about how the heck we got here. But before we do, let's just level set. There's probably a lot of people listening in that aren't in the Wisconsin market that may not know who Chris Ekus is. As you can see, if you're watching the video, he is rubbing dirt in me right now by wearing a jacket with his Ohio State alum logo on it, which we'll talk about. But where were you born and raised?
Yeah, I'm from Ohio, Andy, but I moved up here right after I graduated from the Ohio State University.
And I know you grew up a pretty good athlete.
Well, I'm sure I have some classmates and teammates that might dispute that, but yeah, I had the pretty, I think, typical upbringing in small town Ohio. I was on the football team, and but also I was on the track team and had a great experience. I was captain of both those teams my senior year, and it was just a tremendous experience.
That's awesome. And I know if you're not watching the video, Chris, you said 68, is that right?
I'm about to be 67, yes.
67. Right. If you've met this guy in person, he does not look 67. He looks about 55. So it's obvious health is still very much a priority in your life. Well, a little interesting story most people don't know about you. And one of the things that ties a lot of our guests on the Bullpen Sessions together is they're in the insurance industry, but they have a past playing college and or pro sports. And though you were a football and track athlete in high school, you went to the Ohio State, notice I said the Ohio State University, and played a very different sport. Talk about that.
Yes. So, Andy, we still had a phys ed requirement when I was at Ohio State University to fulfill in order to graduate, and didn't do any of that my freshman year. And on my sophomore year, I figured I better get those covered off and thought I would try something that I'd never been exposed to before, and saw the fencing club or a fencing class going on essentially outside the weight room and in that area of the building. And I thought, I'll try that. And I took it for a class one quarter. Then I followed up with the fencing 102 or 201 the second quarter. And in spring, the season for the team had ended, and they were having their spring practice. And I talked to the coach and said, "What about it?" And he said, "Yeah, we'd love to have you on the team." So I was actually on the team my junior and senior year, and earned my varsity letter at Ohio State.
Well, I could tell you, Chris, I've had football players, baseball players, basketball players, soccer players on this podcast. I've never had a fencer. And I know there's a lot of people listening that are like, all right, I need to understand this, because to the layman, you see two people standing face to face in what appears to be jousting. right? And playing with, as I said offline, playing with swords. Give us a little background, a little history on or just a 101 on fencing for us ignoramuses who don't really understand the sport.
Yeah, well, don't feel isolated out there, Andy. A lot of people, including myself, were in the same situation. And it's basically, or essentially breaks down, there's 3 weapons in fencing. And we call them weapons, not swords. And there's foil, which most people think of with fencing foil. They're all derived from activities that you would have had in medieval times with your weapons. And foil is a very thin blade, and you have to get all the way to the torso in order to score a touch in foil, because that is how it would have been with that type of weapon to inflict any damage on somebody. Epee, which is what I fenced, was a little different. It was much thicker, bigger guard on the for your hand, because the entire body was the target. And so that being derived from, you could literally inflict any pain and damage onto someone, hitting them anywhere with an epee. And then the one that's probably the most interesting to watch for someone that doesn't have experience is saber. And saber, unlike the other two, is a cutting weapon, meaning that you slash across the person with a saber. And saber is derived from the target being anything from the hips up, because you would have been on a horse when you're using a saber. And today, all 3 weapons are scored electronically. You are on a copper strip, which has the markings on it of the various positioning that you have to be in the auto balance on there. And then you hook up to a power cord that's attached to a reel that extends out when you move out and back, and then back to the desk where you light up either red or green if you scored a touch on someone. So it's pretty elaborate that way, but makes it very simple and relatively easy to understand. Certainly while you're fencing, it's easy to understand with the lights. And you have a director that sort of is the referee, so to speak, during the action.
It's interesting because, so what I'm hearing you say, right, is like, if you think in other sports, baseball, it's runs, basketball, it's points, football, it's touch, points, soccer, it's goals, hockey, it's goals. What you're saying is in fencing, it's touches.
Correct.
And, It's one of those sports, right? If I'm flipping through the Olympics, they might have that on in that specific time.
Right.
It's a Summer Olympic sport, correct?
Yes.
And I never thought, what's interesting is you never thought about the fact they're actually hooked up via cords, and they're standing on a copper plate to be grounded, correct?
Yes, correct.
Because there's actually electricity involved.
Yes, because in order to make sure that there isn't an inadvertent touch, if you hit the floor, whatever that flooring is outside of the copper mat, you want to make sure that the light then doesn't go on. And it's interesting. There are other elements of it, Andy, that are precision measurements to make sure that somebody doesn't have an advantage. But in fencing, the higher score loses. So if I had 10 touches against me, I lost, because that's not a good scene. And so it was just great. And we had a real diverse group of guys. At that time, the team was, there was a separate men's team and a separate women's team. Today they're combined, as they are at other schools. And just had a really interesting group of guys. We had black guys. We had a guy from Hong Kong. We had a guy from Korea. We had a guy from Iran. Guys from the cities, me from a small town in Ohio. It was just so interesting, and we traveled a little bit because at Ohio State we had a pretty good budget. Thank you, football team, and we had a pretty good budget, and we fenced against people that were phenomenal global fencers. I mean, they would come to Eastern Europeans, and other Europeans would come to schools, particularly like Wayne State and Cleveland, Wayne State and Detroit, Cleveland State and Cleveland. Notre Dame had a lot of Europeans, and so you'd be out there fencing people that had been in the Olympics. And by the way, you knew from the other team if they had European fencers on there, because they were the ones that were in the parking lot smoking a few cigarettes before the bouts. and they were in their mid-20s. And you were like, okay, I don't have a chance against those guys.
That's awesome. And that's diversity before diversity was a thing. Wow.
That's right.
Yeah. Quick question for you on that, because you grew up playing high school football and you were a track athlete, which are built a lot on strength and speed. If, fencing is very much mental as well. It's like a human chess match. Was that a tough transition for you, going from a sport where you could just muscle yourself through it versus a sport like fencing where you had to be much more, again, thinking and playing the game of mental chess?
Right. I would say that most people don't realize that the physicality and the challenge of that is greater than you would think that it is. But what it really comes down to being effective and a talented fencer is finesse and nuance, that precision of being able to create those kind of feints and get people to react to that, and then for your subsequent reaction to their action is just really a challenge. And those that were best at it were not only gifted athletes, but really, really understood the finesse that it took to be an outstanding fencer.
Yeah.
Not me so much.
Yeah. Well, it is, but I can only imagine the lessons though that came out of fencing at that level, and competing with guys from Europe who were probably fencing at a whole different level, right?
Throughout their lives.
Yeah.
When I'm playing football and track, they were fencing.
Yeah. You did bring up Ohio State football. So we're recording this the day before Thanksgiving. The big game is on Saturday. This will go on air after the game has happened. So this is your chance to make a prediction, Chris. What's your prediction for Saturday?
I'll say the Buckeyes. It'll be less than a touchdown. And it's that school up north, Andy. There is no name for it. We don't refer to it by name. So
I got to tell you, as a Wisconsin Badger fan, we have Luke Fickell, right? Former Ohio State alum.
Yes.
And my prediction is whatever happens with this sign stealing scandal, Harbaugh's heading to the NFL when the year's over. Therefore, Michigan's looking for a coach. I have that fear that they may come after Fickell, but I also have that hope that there is no way he would ever consider Michigan.
It would be hard to imagine, but Luke Fickell is the real deal. It's been a tough year in Madison, but not unexpected. And he is, I wouldn't anticipate that he would make a jump after.
I don't think so. And Badger fans need to understand patience. This is a turnaround here, and the talent level there isn't very good right now. So they got to give it a year or two. Right. But yeah, I'm excited. Every Ohio State fan I've talked to that knows I'm a Badger fan is like, yeah, when we heard Wisconsin hired Fickell, we were like, oh, wow.
Yeah. He's the right guy.
Well, let's transition to health insurance.
Yes.
Something you've been a part of for 30 plus years. And you're here in Wisconsin with me. You've been up here in the industry for over 30 years. So you've got a really cool presentation about the history of health insurance. And my goal for the rest of this episode, for everybody listening in, here's what we're going to talk about. Number one, how did we get here as an industry? Two, why is our system unlike any other in the world? And three, why does it matter to you as an advisor? But before we get there, Chris, I'd be curious, what led you to want to develop this presentation in the first place about the history of health insurance?
I would just, Andy, I've always been interested in history, number one. And number two, I just had heard things about where little bits and pieces about how our business evolved and our industry evolved. And then, of course, the Affordable Care Act in 2013, implemented in 2013, was such a dramatic event that as I saw more people coming into our business that came in after the Affordable Care Act or during that time, it just occurred to me that there was just such a gap in knowledge of how we got there, including myself. And like a lot of us in the business, and we have ideas about and information and knowledge of this development, but we're oftentimes wrong about the dates, oftentimes wrong about the sequence of these events. And it just, as we were approaching and thinking about, as I was thinking about the 2024 election, I was just thinking about, wouldn't it be, as I hope this should be, and I hope it is, at the top of the agenda of the political parties. I just felt this was something, a story and a message that needed to get out there.
Yeah, no, I've had a chance to see it from a high level, and it's very interesting. So I think if you're tuning in right now, what we're going to talk about here as far as the history, Chris, I'd say, from ACA on, we'll leave that alone. I think most advisors have probably been a part of the industry long enough to, at least they were there when ACA came about, or have a good pulse of why it came about and what happened. But let's go way back. I mean, we're talking mid-19th century, probably before insurance policies existed. What was health care like in this country back in the 1800s? Because you refer to hospitals as the factories of death. Talk about that.
Right, Andy, because what I do even during my presentation, I ask people to imagine the most dangerous place you can be on earth in the turn of the century in the early 1800s. And of course, people think of exploring the jungle wilds of Africa or paddling deep into the Amazon, something like that. But the reality was, the dangerous place on earth was here in hospitals in America. And as I said, there were factories of death. The knowledge level of medicine was barely any more than what the ancient Greeks had with Hippocrates. Seriously, there were a few revelations over the centuries, but they had little more knowledge than what Hippocrates had back in ancient Greece. And so it was deadly. And people that had resources, they didn't get their care in a hospital. They got their care either at home or at the home of their physician. And even with the discovery of anesthesia, all that in the early 1800s, all that did was mean that you weren't in pain while you were dying. While you had your limb removed or whatever other surgery you had or other reason for anesthesia. You just weren't in pain, but you didn't survive.
Yeah, it's almost like if you were hospitalized, it could only lead to one result, death. And what's interesting is you talk about it being the factory of death. Nowadays, I think people also get very misled by the looks of a hospital, right? Drive by any hospital in this area, especially, and you're hard pressed not to find a crane that is adding a new addition onto the hospital. And these things are palaces now. And I think people have this perception because of the beauty of the hospital. It must provide the greatest care on earth. And that's just not the case, right?
Well, I had someone once describe that. Do you know what it says over the door of the worst performing transplant center? It just says transplant center. It doesn't say it's the worst one. And so you need to find resources to be able to evaluate quality and care.
Yeah. And this could be for a whole nother conversation. I think the average consumer just has the belief that if it's a higher price service, it must mean higher quality. And what they don't understand is healthcare is not like buying a car or a TV. It's some of the best healthcare out there is also some of the most affordable because of how efficient they are. And so that's definitely an educational piece we have to push out to consumers more often than we are. So here we are in the 1800s, Chris. We're dealing with the factories of death. What were some of the changes that occurred at that time in the hospital system to ensure that you weren't coming for one result, which was to die.
Yeah, the real pivotal moments came in the 1860s when Louis Pasteur, the French scientist, and a brilliant English surgeon named Joseph Lister, and others discovered that microorganisms were the cause of disease. And it was really at that point that medicine became a science. And once it became a science, then there was the ability to really attack certain things. And we saw immediate changes in pasteurization. We saw immunizations, which had been more accidental discoveries, and now they could target conditions. Sanitation cities were cesspools of disease, and sterilization, coming back to the hospital, where Lister really pioneered the use of carbolic acid to sterilize the operating rooms. So as the late 1800s, people were becoming comfortable that if they went to the hospital, they were going to get care. In 1872, there are 147 hospitals in the United States. In 1972, there are 7,000.
Wow.
So that was the beginning of that transformation for people to realize they could go to a hospital for care.
Hi, it's Andy Neary, and thank you for listening to the Bullpen Sessions podcast. Did you know the ideas shared on this show are things we actually specialize in helping you implement? If you're an insurance professional and you want to turn your credibility into consistent client acquisition, visit CompleteGameConsulting.com and schedule a free strategy call. Again, that's CompleteGameConsulting.com to request your free strategy call. All right, let's jump back into today's podcast episode. About that time, if I have your timeline correct, mid-1800s too, we were starting to see our first form of, let's call it, insurance policies, right?
Yeah.
Talk about the first accident policy coming in 1850, first group life and accident policies coming around 1900. What were the initial attempts of providing sponsored health insurance? What did that look like at the federal and state level back in the late 1800s, turn of the century?
Sure. Well, what happened, Andy, was that those steamboat and rail accident policies came out in the 1850, and that was the first type of policy of any kind relating to health and accidents. But they were very popular initially, then they were overextended and went out of business, were consolidated into other companies, and in fact, companies that with names we recognize today, Travelers, Aetna, Prudential. But it really was, as we approached the 1900, when we're seeing progressives looking for the federal government to provide sickness insurance for loss of income due to illness. The federal government didn't want to do that. That was popular in Europe. The federal government initially even was opposed to social medicine. So when in 1900, when the insurance companies started offering employers group, meaning to the employers, accident and health policies, then the workers were starting to say, we need coverage for loss of income due to accidents at work from our employers. And then in 1910, we see the first worker compensation policies. But it is that affinity or that attachment to the worker and their employer that was the genesis of what we ultimately ended up with in our employer-sponsored healthcare.
That's interesting. So it was about that time we started seeing two things happen, an increase in expectations, as well as the burden of providing insurance started to be placed on the employer.
Correct. There was an organization, Andy, American Association of Labor Legislation, that they had a template for government-sponsored healthcare. It was really interesting. 26 weeks of hospital, maternity, physician care, $50 for burial, paid for by 4% of the wages contributed by the worker, their employer, and the state government. They proposed that model 15 times between 1915 and 1920 in various states, and it never passed because this country had a culture, both federally and state, of opposing socialized medicine or any sort of government provided insurance.
I think that's important for people to hear, though, because especially for the newer producers, they've heard about universal care and national health care, and they think it's more of a modern day attempt that's been made here in the United States. But
Right.
You've talked about this throughout history. There were a number of times this country had looked at the possibility of providing some kind of universal form of care, correct?
Yes, there were multiple opportunities for the federal policymakers to really adopt a federal plan, but they've been opposed. There were other elements, and I get into that throughout my presentation of what affected and impacted the decisions to not go that way. It's really kind of remarkable given the way our country is, I suppose. I guess in other ways it isn't. We've always been that sort of, in a way, renegades right here in America, and maybe that's the culture, but it certainly is the culture that prevailed in the socialized environment that was more prevalent over in Europe did not transfer to this country.
Well, and I think we're going to have a real quick discussion towards the end about why that's universal care, single payer, all that might not be a good idea. And we'll get to that before we close. So here we're at the turn of the century, it's 1900. Let's fast forward. Our country in the late 20s is on the verge of going into the Depression. This is when we start to see what I guess would be called more of the modern day version of health insurance. I know when I got my life and health certification, this is when you start talking about, I can remember, I think it was Blue Cross provided some kind of insurance down in Texas. Talk about that, because now we're starting to get into what a lot of people know as modern day health insurance.
That's exactly how it evolved, Andy. 1,300 school teachers, Dallas, Texas, agreed to pay the Baylor University Medical Center 50 cents a month for 21 days of hospital coverage.
Can we still find single rates like that, you think?
Yes. It's called Medicare. And join me. Well, don't come any sooner than you have to. And so it was just an amazing success. And the idea was spreading throughout Texas and in the Northeast and around the country. And I described this, and it was in 1932 that the community hospitals in Sacramento got together to create their plan, and they called it Blue Cross. And by 1935, there were 15 Blue Cross plans in 11 states. By 1938, there were 38 Blue Cross plans with over 1.5 million people. And by 1945, there were 80 Blue Cross plans with 19 million people. That was over 60% of the market share. I mean, all the other carriers that were in that realm had to come up with their arrangements similar to the Blue Cross arrangement in order to just be able to compete.
Yeah, I mean, that obviously that time period in our country's history, from that moment on for the next 15 years, not only did we go through Depression, World War II, everything that changed and evolved post-World War II. What impact did those two events, Chris, have on how health insurance evolved in the country, Depression and World War II?
Well, in 1935, Democrat Roosevelt got passed the Social Security Act, which was his committee was charged with coming up with providing assistance to those in financial distress due to age, disability, and illness, which they did. But that committee on economic security actually had national health care on their agenda. But because it would have meant doubling the payroll tax, they just knew that it would never get passed. So that was the key during the Depression. And then in 1940, there are still only about 8% of Americans getting their health insurance from their employer. But now it's World War II, rationing, price controls, and the wage freeze. And it was the wage freeze that the National Labor Board ruled fringe benefits did not violate that wage freeze. So during this incredible shortage of workers in this country, their best attraction for new employees and their ability to retain employees came from their expansion of their benefits, and they did big time.
Isn't that kind of ironic that benefits really became mainstream when businesses couldn't compete on salary or income because of the national wage freeze? So now it had to turn to benefits, and how that still plays itself out today. There's two other things that were happening at that time. Number one, this is when we were seeing a huge influx of baby boomers being born, and the rise of the unions. And even today, both have had a big impact on the cost of healthcare and the cost of the health insurance system, right?
Well, Andy, I described, unions started to assert themselves in the late 40s, right around 50, because of the Taft-Hartley Act. Taft-Hartley said you could collectively bargain over conditions of employment. The National Labor Relations Board ruled that benefits met that definition of conditions of employment, and the Supreme Court upheld that ruling in 49. So that meant that the unions got very aggressive and assertive in their, what I say in my presentation, their negotiations strike for the expansion of their benefits, which their benefits as a percent of their compensation more than tripled for union workers between 1950 and 1965.
Wow.
And then I described that really in 1950, we're heading for this explosion in our healthcare costs, but the boom that everyone hears are the baby boomers. It is millions of them are born. I'm one of them. And there were 76 million, and they will have a tremendous impact on healthcare costs, but not yet. And what I do is I go through and I describe what the cost of maternity is in 1950, and definitely what we're seeing, of course, today is that impact financially of the baby boomers. The financial impact was not during the 50s, by any means.
Yeah, absolutely. I mean, when I think about that, like I said, it is interesting when you look at a demographic of a group today, a single employer and who's on their plan. To me, it's fascinating that in some cases now we have 4 generations in one workplace.
Yes.
Might be the first time ever.
Yeah.
And the dynamics of that and the impacts of that on the cost of health insurance, I don't think people really grasp like they should. And all 4 of those generations view healthcare and health insurance very differently.
Yeah, absolutely.
And so okay, we head into the 60s, we head into the 70s, and if I'm getting a sense in the 60s, this is when we're really first starting to see that this health insurance thing is becoming kind of expensive. Healthcare is becoming kind of expensive. And you have, the Social Security Act and everything going on there. It's a time of make love, not war. Like what impact did the 60s and 70s have on healthcare, health insurance?
So the 60s, the big exclamation point there, Andy, was the Social Security Act of 65 during the Democrat Johnson administration, which created Medicaid, healthcare, national healthcare for the poor, and Medicare, national healthcare for the aged. And so both those programs, the Medical Association had been so opposed to any type of socialized care, but they relented on these because these plans were structured very favorably for and administratively awkward, because in Medicare you have a Part A, well, that was for the hospitals, and in Medicare Part B, that was for the physicians. And so essentially what you saw at that time after that act was physicians around this country saw millions of new patients flooding into their offices now with insurance. And these physicians, almost all of them, their incomes doubled by the end of that decade. But it really drove up national health care as a percent of GDP. And so people were clamoring for national health care as we move into the 70s, or many people were. And that's when Democrat Senator Ted Kennedy proposed a universal coverage, single payer funded by new taxes. But Republican President Richard Nixon, in contrary to his own party, he supported national health care, but not Kennedy's plan. So he countered with his own arrangement that would preserve private health insurance and provide subsidies for those that couldn't afford it. And so there was a lot of discussion about that. Kennedy ultimately walked away from the negotiations, and then a little thing called Watergate came about, and everybody forgot about national health care. Again, another opportunity.
Well, I actually stopped when you said, I think I heard you say a Republican and a Democrat actually agreed. Wow, that's it's not a political show, but man, that's surprising. Well, okay, so early 70s, we also had the onset of health maintenance organizations, HMOs. And, in layman's terms, when you're a producer, HMOs as competitive rates, good benefits, required to stay in the same healthcare system, right? What impact did HMOs, the onset of HMOs, have on the entire health insurance ecosystem?
It was incredible, actually, Andy, that in 1973, Kennedy would propose a bill that Nixon supported. It was going to do what you described: better cost, better access, better quality. So that was the objective. And what that act did was it eliminated some of the obstacles creating an HMO, but more importantly, it mandated that any employer with at least 25 employees that offered health insurance was required to offer a dual choice, federally qualified HMO. That was dramatic legislation in 1973. There were only 3 million people in this country in HMOs at that time, and they were pretty somewhat isolated geographically and by industry. What they generally regard the first HMO was started in Los Angeles, the Ross Luce Medical Center, to serve Los Angeles area public sector employees. So this was not a national solution. HMOs weren't, yet both Nixon and Kennedy felt, as other policymakers in D.C. felt, this was the way to go. And to mandate that and require that everyone offer that as a dual choice was just incredible.
Wow. Well, I mean, at that point, I feel like as an industry and the cost of health insurance, as it continued to rise and increase, now we start to see it accelerate into the 80s. And there's one other pivotal moment I want to talk about, which was in the early 90s. And I wasn't selling insurance at the time. I wasn't in the industry yet, but I definitely remember hearing the famously coined Hillary Care. I feel like that was a turning point of no going back, especially when it came to the expectations of what employees expected out of their benefits and the type of coverage they expected. Talk about what happened in the early 90s with Bill Clinton, Hillary Clinton, and the impact that had on the health insurance we know today.
Yes. So what happened, Andy, was during the 80s, we had the highest escalation to that point of national health care costs as a percent of GDP. It had gone from 8.9 to 12.1% in that decade. It really set the stage for when Democrat Clinton's elected in 92 to take on national health care. And his Health Economic Security Act in 93 was to do that. It was going to preserve private health insurance through employers, eliminate pre-existing conditions. He has his wife, Hillary Rodham Clinton, of course, unofficially be a part of his cabinet to get this passed. They describe simplified and freedom from bureaucracy, but in compassionate care. But this is when the draft of the bill is released. And then ultimately the final bill, we realize that it's anything but that. This is a massive bureaucratic top-down command and control that would govern every aspect of the financing and delivery of healthcare. And what they termed the opponents Hillary Care was just mobilize the insurance industry to create a series of ads. Harry and Louise, elderly couple, or not, a mature couple, I'll say, discussing the burden with anguish and despair that this would have on their lives. And ultimately, employers were not behind this. So and the administration was distracted with other things, but it was a big, big, big deal in the industry and really for the country. But the reaction from the industry is what is a legacy that we're still living with today. And that was all the disruption that as life insurance companies got out of the health insurance industry and were this consolidation. I mentioned in the thing in 1993, here's how disruptive it was. Humana sold their hospitals. Wait, what? Humana was in the nursing home business, then the hospital business, then they got into health insurance. And in 93, they sold their hospitals to Hospital Corporation of America, which was really the catalyst for what we know today of these mega hospital systems, was when HCA bought those Humana hospitals.
Wow. I didn't know that.
Yeah, there was so much. The Blue Cross and Blue Shield Association agreed to allow their plans to convert from not-for-profit to for-profit status. They had to. These plans, so many of them were struggling as their competitors were experience rating their groups while they were still community rating groups. They were getting killed, and they couldn't raise capital or do acquisitions because of their not-for-profit status. So, so much happened. Mass Mutual, John Hancock, Prudential, Metropolitan, all of these enormous life insurance companies all had health insurance divisions. And by the end of the 90s, they're all out of it. None of them remained.
Wow. Well, we just covered a lot, and I know there's so much more you cover in your presentation. But let's answer the question now. There's a health insurance advisor listening to this. Why does this matter? If I'm out selling health insurance, Chris, why is it important that I know about the history of what I sell?
Well, first of all, you need to have perspective of your business. You need to take pride in what you do as an industry professional. And when you do that, that's not just being on time for appointments, having your shoes shine. Let me tell you, all those things are really, really important, and don't overlook any of those. But it extends to really your commitment to your business. And when you do that, you have to understand how it is that we got here, because in order for you to frame a perspective on where we're going, when we look forward, you have to understand these the positions of those in power over the century to know the priorities that they set for their future and how they derived their positions. And that's what I try to do, is stimulate that kind of thought and be a catalyst for all of us that are committed to this, to really consider and appreciate this understanding of all of these constituents, and to be able to provide that advice and guidance for your clients.
No, I think it's important that all advisors understand the history, because it also puts into perspective how important your job is. If we're going to keep this thing, if we're going to prevent ourselves from hitting universal health care, we've got to do a better job with cost and all the things that are heading us down that path to national health care. And the second thing is, you got to remember, most employers buying this stuff don't know what they don't know. They don't know the history. They look on a year-by-year basis right now. And you've got to be able to educate them on why they got to where they got today. I think it just puts everything in such a good perspective. Two more questions, Chris. One, I'm going to ask you how people can get in touch with you, because I want more people putting you in front of their members, their employees, about this presentation. I think it's important. But let's quickly talk about national health care. It's been brought up. It's going to be part of the 2024 campaign. You know it is. But why is that not going to work in America?
Well, national health care creates that when the government is in charge of the health care, what they really have as their lever is price. And when all you do is control price, the end result is a rationing of care, and it lowers the quality of care. Now, is there a role for the government in healthcare? You bet. Is it the Affordable Care Act? I don't think so, because that was tackling, they say, access. They said price, but it hasn't achieved that. And so we need to come up with more creative solutions involving the private sector to create this kind of disruption. We need some enabling legislation. Maybe we need a high-risk pool provided by the federal government. I'm not sure what the solution is, but just imposing Medicare for all or some type of national health care, we are not going to be happy and satisfied with that when we have the expectations that we've developed over the last 100 years.
Yeah, no, I think the national health care, the proponents of it, their stance is we need access for all. And I agree. That's important. Yeah. But they're not. It's making a decision without discernment. You don't know what the back end ramifications are, which is when you give access for all, the only two things that will happen is it will get.
I can't hear you now, Randy.
Did I just get unmuted there?
Yes, I did not hear you.
I'll say it again. Sorry, somehow my mic got unmuted there. I apologize. When your whole mission is access to care for all, it can only go two ways. Price goes up, and the rationing of care is the end result, as you said, Chris.
And the other thing is, Andy, what's the problem with access? That's not the problem. It's the cost of care is the problem. People have access. This is such a fallacy, I believe, in our culture, and too many politicians try to, as they do with so many things, try to exploit that. It's not about access. They're disrupting the entire system for maybe 3% of the population. There are better solutions. I don't know exactly what they are, but you don't have to turn the entire system upside down for that.
Yeah, absolutely. I agree. Well, I love what you're doing, Chris. I know you are giving this presentation, the history of health insurance, to insurance agencies, associations like NABIP. If somebody's listening in and they are a board member of a NABIP chapter, or they have an agency where they're like, hey, I would love to have my employees have a better grasp of why we've gotten to where we've got, what is the easiest way to get in touch with you?
So thanks, Andy. And it's something that I'm approaching the end of my career, where I've been working for the last 28 years. And so I haven't really developed to the extent I want to, this consulting arm here to be able to take this thing to the next step. But I'm out there. Chris Ecos, my name, ChrisEcos at yahoo.com. I am on LinkedIn. And as I have mentioned to you that day we got together, I'm still in the phone book. So as long as my in-laws are around, we have to keep our landline. So I'm out there, and again, through Chris Ecos at yahoo.com, through LinkedIn, and my, then I'd be happy to give anybody my number after that. And of course, you have it. So would love to hear from anyone that would be interested in this message that I'm putting together. And I'm going to be working on some others as well.
Well, yeah. And I could tell you, Chris, once this goes out on LinkedIn, I'm sure you're going to get a lot of messages, a lot of follows. You're going to have people sending out LinkedIn invites to you, because I think this is an important topic. I've gotten an inside peek at the presentation, and I think it's really important more people in this industry hear it. Somebody who had his health and health license, you get a very small snippet of the history of health insurance as you get licensed. But having that perspective of why we've arrived at the place we have, and not just a perspective on the last 15 years, is so important. So thank you again for taking the time to be here. This was excellent. And I'm excited to have a lot of health insurance advisors hear this.
Well, thank you, Andy. And it was certainly my pleasure. I enjoyed sharing this.
For everybody else, take notes on this and use this information Chris has shared with you to put a better perspective on what it is you're selling, understand how important what you're selling is, and then use this as an opportunity to educate your clients and your prospects so they can have a much better perspective on why they're buying what they're buying and why it costs and what it looks like today. And because there is a history of information, laws, rules, events that have led to where we are today. Be good. Thank you for taking the time to listen to today's podcast episode. Remember, if you found value in this episode, do me a favor, give it a like, share it, post about it, go subscribe to make sure you get every episode from us every single week. And my only ask from you is that if you have anybody in your life, whether it be a teammate, a peer, family member, or a friend, please share this podcast with them. That's how we grow. We only grow through word of mouth. And I would be forever grateful if you take the time to do that. All right, now it's time for you to take what you learned and it's time for you to go out and share your message with the world. Execution, clarity, and consistency is everything. Be well.